Hello and welcome to today's patient education video series. My name is Dennis Sadeh from Park Compounding. Today's video is going to focus on reconstituting lyophilized vials for injection. These are preparations that are freeze-dried for medications that are perishable in solution. This allows them to be stored generally for longer periods of time and usually out of refrigeration. Today we're going to focus on two different sizes. We have 1 milliliter lyophilized injections and then some that are 10 milliliter injections. Today let's begin with the 1 milliliter injection. It's important to remember to organize your supplies prior to beginning your process. You don't want any interruptions so you can complete the process from beginning to end without interruption. Let's begin by removing the protective cap on the flip top on the lyophilized vial as well as the diluent vial. Generally speaking, the diluent is bacteriostatic water for injection. Since we're using a 1 ml solution, we're going to use a syringe that's 1 milliliter. And then before we begin, what we want to do is swab the rubber stoppers on both vials using a circular motion to remove any debris that may have landed on there. Both vials. We're going to pull back the plunger on the diluent syringe to the desired level of diluent. We're going to withdraw, remove the protective needle cap, and then using a 45-degree angle enter the rubber stopper, press the air into the vial, and then invert. Slowly we'll pull the plunger down to the desired level, tapping the syringe against the palm of your hand to remove bubbles, pushing them back into the vial, and then pulling the plunger back to the desired level. In this case, 1 ml, we'll remove the syringe. Using the same technique, we're going to, at a 45-degree angle, enter the lyophilized vial and point the needle to the side of the vial to avoid getting suds or foam inside the vial. Once it's all injected into the vial, we'll remove the syringe, replace the cover, and then we want to swirl the vial gently. Again, you don't want to create foam. You want to swirl the vial until the entire powder is dissolved. These dissolve within 30 seconds, at most 1 minute. You can inspect the vial to ensure that the entire powder has been dissolved. Now we're ready to withdraw solution for injection. In this case, dosing is generally done with insulin syringes. Right now we're using a 310 cc syringe. We're going to pretend we have a dose of 10 units or 0.1 milliliter, and we'll remove the protective cap. First pull back on the plunger and the amount of air that we're going to inject into the vial. Remove the cap. Then again, using a 45-degree angle, enter the vial, push the air in, invert the vial, and slowly pull back on the plunger. Once again, we have a little air bubble. We'll tap that, push it back in, and then bring that plunger back to the desired level. Remove the needle, and the injection's ready to be injected. It's important not to store the medication in syringes. You want to withdraw it immediately prior to injecting. Also important to note that once you reconstitute the vial, it's an important part to date the vial so that you know when you reconstituted the vial. This particular injection is only good for 7 days from the date of reconstitution. Additionally, it needs to be stored under refrigeration once reconstituted. It's important to look at the directions and instructions on the labeling to ensure that you store the product properly, and the date on the vial is very crucial in terms of letting you know when to discard any unused portion. And now, just quickly to demonstrate the larger vial, again, we're going to remove the protective cap. Using the same process, we're going to swab both vials using a circular motion. And in this case, the specified amount of diluent is 10 milliliters. Can be anywhere from 1 to 3 to 10. You need to look at the instructions on your label. If you have any questions, contact your pharmacy. Again, we'll pull back on the syringe to the desired volume. We're going to withdraw of diluent, remove the needle cap, 45-degree angle, push the air in, invert, and slowly pull back. And we're going to tap against the palm of our hand to get rid of any bubbles that we may accumulate, push them back into the vial, and pull the plunger back to the desired volume of diluent. In this case, 10 milliliters. And then once again, using a 45-degree angle, enter the vial, aim the needle at the side of the vial, push the diluent slowly into the vial so as not to create foaming. If there's any back pressure, you'll need to pull back on the plunger to remove any air that's causing the pressure inside the vial. And once again, we're going to roll the vial between our hands, inspect to ensure it's completely dissolved, and once again, we're ready for dosing. And then we'll swab the vial once more. In this case, let's do a dose of 0.3 milliliters or 30 units on the insulin syringe. Pull back the plunger in terms of the air that you want to inject into the vial at a 45-degree angle. Push the air in, invert the vial, and again, pull back slowly on the plunger, tapping to remove air bubbles. Push them back in the vial, and then pull this back down to your desired level. That's 3/10. And again, that's ready for injection. And once again, remember, we're going to date that vial for the time and date of reconstitution. Again, these need to generally be stored under refrigeration once reconstituted. They have a variety of expiration dates once reconstituted. The expiration date on the label is for the unreconstituted lyophilized vial. Also, it's important to have a sharps container to ensure you can dispose of needles safely and cautiously. And that concludes our demonstration today. Thanks for joining us.